Welcome to Rainmakers, where we cover the world, and we're very fortunate today to have with us one of the world's foremost experts in chronic disorders and the importance it is not only to the Western world, but also to the low and middle income countries too. Dr. Ali Mokdad, Professor of Global Health. Welcome to the show.
Thank you. It's a pleasure to be here.
So let's just get right into this. Okay, chronic disorders, this is something that is first, not necessarily first on my list of the things that I would be most interested in as a kid, but you've always been interested, huh?
Exactly. And for many reasons. I grew up in a house where parents were smokers, and I've seen people around me related to me dying from chronic conditions more than infectious diseases. So it became a passion for me to work on it as I chose this path and this career.
So you grew up in the Middle
Beirut,
East?
Lebanon, yes. I'm Lebanese, yeah.
And then you came to the United States to study?
For a PhD at Emory University, and I started working at CDC, and I stayed at CDC, Centers for Disease Control, for 20 years. I recently moved here to University of Washington.
And for those in our audience who are viewing it outside of the Seattle area, we are here at the university, or near the University of Washington, and you work also in measurement and metrics relating to chronic disorders too.
I work with an institute here, the Institute for Health Metric and Evaluation, where our mandate is to look at three things in terms of health. Basically, what are the problems that people are facing? So, what are the performance of the systems that are dealing with these conditions? And the third question, which is of great interest for us, is how could you be more efficient in producing a product at the lowest expenses in order to get the maximum benefit?
Okay. Well, we have a lot to talk about because of the work that you have done, but particularly about something that really it was being talked about all over the world right now in global health, and it's non-communicable diseases. I never even heard of that. What is a non-communicable disease?
It's usually referred to as chronic conditions, but our diseases, to make the distinction, is that I cannot pass it to you through an infection like measles or diarrhea. So these are conditions that are usually related to behaviors. They take a long time to appear, sometimes shorter, but they are at the higher expenses in terms of their fatality rate and their cost of maintaining them.
All right, so the World Health Organization had just recently released some statistics. Basically, they call them their 10 top facts, and we've got a few of them. One of them is NCDs, primarily cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes. 63% of all deaths worldwide is attached to something that you're studying.
True, and unfortunately, this is increasing. As you know, many of the countries have been dealing with infectious diseases for the past hundreds of years.
And infectious diseases such as?
Contagious, malaria, TB, polio. And we've had so many.
HIV and AIDS.
HIV, AIDS, and we've had so many success stories in infectious diseases. But many of these countries are facing what we call now an epidemic shift, epidemiologic shift, where they're dealing with double burden. The burden of chronic conditions are increasing in many of these countries, many of the poor and developing countries. And they're facing two problems at the same time with their limited resources. And unfortunately, as you cited the statistics, most of the problems that we are facing now in the world are chronic conditions.
So all this time here in the United States, we have looked at Africa and other developing regions as if, okay, we need to help you clean your water, we need to help you clean up malaria, but now we're facing an even bigger problem.
Exactly. Now we're realizing that they're facing the same problems we are facing in this country. They're really doing the behavior that we are doing in this country, the bad behaviors, and they're facing, as a result, they're facing the same problems we are facing here, same burden of disease.
Another fact from the World Health Organization is that 80% of deaths from non-communicable diseases are in low and middle income countries. And just recently, I think it was in late April 2011, there was a conference held in Moscow of nations all over the world who were addressing this, many of them low and middle income countries.
True. The main misconception was that chronic diseases are diseases of the affluent population. In reality, we're realizing now that everybody is facing the same problem, even poor countries. You look at your countries in Africa, India, China, Lebanon, where I come from, any country in the Middle East, and many of these deaths are occurring among poor people.
Why is that?
Because we've been successful. I mean, we should take some credits. We've been very successful in dealing with many of the infectious diseases. At the same time, many of the behavior that are associated with chronic conditions have been adopted by everybody else. Lack of physical activity, poor diet, and all what you have like this in terms of diet. And then as a result, we have an outbreak, we call it an outbreak or an epidemic of chronic conditions all over the world.
Well, I would have said that you have to die from something until I read this next fact. And this next fact is that 25% of deaths from non-communicable diseases are with people under 60 years old, basically premature deaths.
True. This is premature deaths that we talk about here. And when we talk about prevention, we want to prevent premature deaths. And that's the major issue. Another misconception about chronic conditions, that people are dying at their 80s or 90s. That's not true. They're dying at their most productive years of life, when we really need them to be productive and support their families and those who are behind them. This is kind of a vicious cycle when you look at in terms of poverty, education, and outcome. It's really affecting the young adults in many of these developing countries.
Now, can prevention really work? I mean, here in the United States, we've talked about prevention for years, but I see our healthcare system as being one of treatment as opposed to prevention.
How prevention works. I mean, this is again a big misconception. Yes, we have a good treatment here in the United States, but prevention does work. We have lots of studies, clinical trials that showed if people exercise and eat properly, it does better. That change in behavior does better than even medication for diabetes. There have been tons of clinical trials showing that impact. Behaviors do work, but it's very hard for people to adopt behavior. And we need to keep in mind also that when we ask somebody in our studies, we say, how often do you exercise? People may underestimate what they tell you. They may tell you, look, I exercise 2 hours a week, 3 hours a week. In reality, they're doing half an hour. That's why you don't see it. So you don't see it not because it doesn't work. You don't see it because people are not doing what it takes to reach that health objective.
Well, let's talk specifically about low and middle income countries, because the next fact is that non-communicable diseases entrench people in poverty. This, again, according to the World Health Organization. They entrench people in poverty due to catastrophic expenditures for treatment. So they're getting hit from two directions.
Exactly. And unfortunately, in many of these developing countries, you mentioned here in this country, we have a good medical treatment. We also have a good screening program, where we do our screening for cancer, mammogram, pap smear, take blood pressure, for example. In many developing countries, that doesn't happen. So you have somebody who has blood pressure, high blood pressure, and suddenly he or she will have a stroke or a heart attack. Then the family has to pour in all the resources in order to prevent a death or treat that condition. Here in the United States, fortunately for us, we have screening ahead of time. So we have early detection where we could deal with a condition better. We have more medication. We have better access to hospital. That's not true in many other countries. So they have to go to a capital city or they have to treat somebody. And yes, it bankrupts a family.
Well, in low-income countries, because we have talked about this in the past on Rainmakers, where women in very young age are contracting cervical cancer, and that basically destroys the family.
True, and then we don't have screening, we don't have pap smear in many of these countries. Now we know that this disease is preventable through vaccination. We have a vaccine for it. Again, we don't have many of women outside the United States vaccinated for cervical cancer.
Here's something that I don't understand. Another World Health Organization fact: nearly 20% of the world population is overweight. I get that. Right? They think it's very heavy here in the United States.
True.
But many of them are children.
True.
And I thought that if you live in a low-income country that is basically in famine, that you're not going to be overweight.
But that's, again, one of the misconceptions about chronic conditions. When your best option for cheap food is bad food, bad diet, that would lead to obesity. Take a country like China, where they have controlled their births. They have one child. You have a child who is supported by 6 people, mom and dad, 2 parents, grandparents from one side, 2 grandparents from another side, where all the food, all the attention is given to that child. Add to it, the child are not physically active. They're sitting down watching TV and playing on their computers. When I was growing up in Lebanon, we had one TV channel, was boring. I mean, we will be outside playing. Now, if I go back, my niece or my nephew, they have all the TV channels we do have. They have an air condition inside the house. They're inside. They're not outside playing. and the bad food. When I was growing up in Lebanon, in order to attract me, a place would have a nice display of fruits and vegetables outside. Same store where I grew up in Lebanon right now will have a nice display of chips and all the stuff that you will find here. So even my nephew and my niece now are getting the junk food that my daughter has access to it here living in Mercer Island. So it's a sad story. It's a sad story that we're changing our behaviors and our lifestyles in a way that is negatively impacting our health.
Is it being led by the West?
I wouldn't call it led by the West. People are enjoying the success that we have here in the United States, where you're expanding your economy. People are now can afford a car in China, so they don't have to buy it. They have the big house. They could afford to have a TV or a computer or a PlayStation for their kids. We're enjoying a success of our life, I guess. It's more than blaming the West here. People are looking at us and saying, you know, they've been very successful and this is how they enjoyed their success. And we are human beings at the end of the day. You and I could celebrate now if we do something good, we go out and we have a nice meal and we have a nice cake after that. So that's part of our life as humans.
So are you saying then that natural human behavior is self-destructive?
In a way, I would say it is, unless we realize that many of these behaviors are causing us diseases. So we look at them as like enjoying our life. It's very hard to go back. It's very hard to turn. I don't expect my daughter to live the same way I live. That's very hard. But I expect myself to be a role model for my daughter. So to be outside there exercising with her. If I sit down next to her and watch TV, she's going to be watching a TV.
Here in the United States, we have the Food and Drug Administration providing us a food pyramid. And so we are constantly being fed information that shows us what to eat and what to do. In developing countries, low and middle income countries, do they have governments helping them?
Some countries do. They have their own food pyramid like we have here in the United States. Some of them take what we have and modify it to meet their diet. The challenge is not only that. The challenge is, again, this is an issue that has to be dealt by different players. It's not only the issue of understanding what diet I need. It's also accessibility to that kind of food. If around the village where I live there is no fresh fruits and vegetables, then that will be a problem. So if you live in a big city, which is true in many of these developing countries, people move from their village and their natural environment and then go to a city where they're seeking a job and employment. They have less time to have a fresh meal. They don't have access to fruits and vegetables. They end up eating something fast food, bad diet for them.
A lot of what we talked about with regard to diet here in the United States, we would think, okay, that relates to cardiovascular disease, diabetes, things like that. But it also relates to cancers too.
Cancer, of course. Diet is very strongly associated to cancer. There have been a lot of studies about the composition of diet, fat, fruits and vegetables, antioxidants, and its association with cancers, lots of cancers. Tobacco is another thing as well.
Are governments in low and middle income countries concerned about this?
Not as much as we would like them to be. And I'm not trying to be, trying to cause problems here to you or to your show or to myself and my institution, but we would like them to be more interested, and that's why we had this meeting. WHO called for this meeting in Moscow. It's not on the radar screen of many health officials in many, and unfortunately in many developing countries. Some of them do. Like India, who's now the ex-minister of health, was a very strong advocate of preventing chronic conditions. There's still these ministers of health or these governments are still dealing with an infectious disease burden. And it's more of a risk for them if they fail in an outbreak and many people will die from a condition that they could have prevented. Keep in mind SARS, for example, or flu. So they get ready to deal with an infection, unfortunately at the expense of chronic conditions. My message would be there is something that's immediate today that I have to deal with as a minister of health, let's say, and there is something important that I have to lay the ground for the future in order to prevent chronic diseases and conditions. That balance between immediate and important is crucial, and I don't think every minister of health is working on that balance.
We're going to come back to that. We have to take a very short break. We're very fortunate on Rainmakers here to be talking with Dr. Ali Mokdad. He was a professor of global health at the University of Washington. He is an expert, a global expert on metrics and chronic diseases. And basically what we're here talking about today is what governments and also what societies can do and cultures can do to actually prevent a lot of the premature deaths that are happening. Not a fun subject to a lot of people, and it's not. But you talk about prevention. You've talked about the issues that that are difficult for ministers of health. But another fact from the World Health Organization was that the major risk factors are tobacco use, harmful use of alcohol, poor diet, and physical inactivity. You've talked about poor diet and physical inactivity. However, the harmful use of alcohol in the Middle East, heavily Muslim population in the Middle East, very, very dominant Muslim population, drinking alcohol is against the religion. How can that even be a factor at all of an NCD?
Well, again, another misconception that Muslims don't drink. We have people who drink in our culture, and I grew up with friends who drink. I have friends who drink. So alcohol consumption is very high, and unfortunately it happens in closed doors. Some countries allow it in restaurants, Jordan and Lebanon, you could go and have a glass of wine with your dinner. But many other countries where it's prohibited, so it's happened inside the houses. Alcohol is a major risk factor for lots of conditions, from liver diseases to cancer, but also car accidents, drinking and driving. Mm-hmm. It's very common in the Arab world. I mean, it happens, unfortunately. Our governments should deal with it better and bring it up to the open and discuss it and have plans to prevent it. We don't have, unfortunately, in the Middle East.
I want to spend a good bit of the rest of the show talking about something that just scared me when I saw this fact coming from there's a quote from the World Health Organization, Dr. Douglas Betcher from the World Health Organization. He says this: tobacco could kill 1 billion people in this century. Not 1 million, not even 100 million, but 1 billion people. That's basically, right now, it's almost 20% of the planet, almost. 1 billion people from tobacco. And it's real simple, it seems to me, to get rid of it.
I wish it was so. Tobacco is a major killer. In the United States, it's the #1 killer. Kills in the United States over 400,000 premature deaths a year. Mm-hmm. In the United States.
It's lung cancer.
Lung cancer mainly and heart diseases, but lung cancer is a strong association between tobacco and lung cancer, but also affect other cardiovascular diseases as well. Unfortunately, in many countries in the world, tobacco is becoming an epidemic where people are smoking more and more. Tobacco companies have been successful in promoting their products in many countries. At a time where these countries don't have the resources to put a fight against tobacco in their countries. Tobacco is very cheap in many countries. It's so cheap. In this country, we've taxed it. We've done successful campaigns to increase the taxes, to prevent people to buy it. We shut down outlets. We have laws that do not allow people to smoke in public. That doesn't exist. And many countries, developing countries, a kid 10, 15 years old could walk to a store and buy tobacco. Nobody will say no. It's very hard if you travel in the Middle East, where I come from, in Lebanon or Egypt, to go and enjoy a meal without having people around you smoke.
Really?
It's very hard.
But don't the ministers of health there in those countries know the difficulties of secondhand smoke without regard to firsthand?
And they do, and unfortunately many of them are smokers themselves. So another example where the focus and the attention has been on dealing with infectious disease rather than chronic diseases. Another problem is dealing with treatment. So you have a minister of health in Lebanon, for example, or in Jordan, willing to spend a lot of money treating cancer because he doesn't want political problem or unrest in his country or her country, but is not willing to put a fight in order to enforce in the society a place where somebody like me could take my daughter and go and sit in a restaurant without being exposed to secondhand smoking. It has been a challenge in many of these countries.
The UN is holding a high-level assembly in September 2011 about non-communicable diseases. Particularly if tobacco is going to be killing 1 billion people in this century, if somebody's got to be making money off of it. And frankly, in a low and middle income country, most of the economies are agriculturally based.
True.
That being the case, how can a government tell a farmer that, sorry, this is too unhealthy for you to grow, you're going to have to grow something else?
That's one of the major challenges you're looking at it from a production, a farmer who's making a living or for ages doing what they do. Tobacco is a product that makes for that person easy money. Unless you have a program to come to this farmer and say, I'm going to give you something to subsidize the fact that you're growing tobacco, you're not going to be successful. He or she will keep growing tobacco, consume it or sell it. Governments don't have these programs like we do here in the United States, where we give farmers subsidies not to grow something or to grow something else. That fund doesn't exist to help that farmer to switch from tobacco to something that's good for the community, fresh fruits and vegetables. Unfortunately, we don't have programs like this in many of these countries.
Is there a movement among health experts to encourage governments, especially the wealthier governments, to create a fund, create a subsidy fund, create something that will get farmers off of the income of tobacco and into something else?
Not to my knowledge, not in many places where I have worked. There is no such program. There are push for preventing smoking, increasing taxes from WHO. The meeting that you mentioned will definitely tackle tobacco because it's the leader killer. But there are no programs, specific programs to help farmers to switch from tobacco to grow something else.
We've talked about the cost of cancer, particularly to a family, especially if it's a woman,
Exactly.
a young woman that contracts cervical cancer. There are, because unlike a car wreck, cigarette smoke is not an immediate killer. It takes time. Mm-hmm. Are there additional costs that a low and middle income country will have, or a family in a low and middle income country would have, in relation to contracting cancer from tobacco?
If you back out from taking the specific tobacco, for example, which is by far the leading cause of premature deaths, but you look at it from a country, from a government perspective, a developing country, and you look at an epidemic of chronic diseases coming, cancer, cardiovascular diseases, and diabetes. And the only way to deal with it has been by these countries is to treat. They're not spending money on prevention, which you and I are talking about we should prevent. That's a recipe for bankruptcy in the future. Beside the morality of it, people are dying, we're losing lives, productive young male or females in their most productive life. The cost of treating these patients as they grow older, and we have now wonderful drugs, so they stay alive longer on medication, it's tremendous, and it's going to break these countries in terms of economy. Look at us here in the United States. With all our wealth, we can't afford to treat. We're spending a lot of money on prevention. It's timely to push the message of prevention for many of these developing countries, because the option, the other alternative, they can't afford it.
So what do we do? How can we as a society, let's say that someone is watching the show in Seattle, Washington, where we are. What would you tell them that they could do?
Okay. We have the science. We have institutions like us who are putting out the science and saying we're about to release a global burden of disease, where we're showing the scientific fact this is a #1 killer. We have somebody like the WHO. We have a lot of people now who are making it. Even the American Cancer Society here in the United States is lobbying on behalf of chronic conditions. We have a lot of people who are coming and saying this is an urgent problem that all of us, we need to deal with it. We have the donors now. My pitch would be to donors. Chronic conditions have been looked at as not something that we should invest in, because all of us would like to save children from dying from infectious disease, malaria, TB, HIV/AIDS, and we're doing a great success story. We want to eradicate polio, and we should, and we're about to do so. It's time to put money into chronic conditions as well. All what we could talk about, all what we could do, going to a Minister of Health and say you have to deal with it, unless we put some money, some seed money, to push in that direction, we're going to fail. So my pitch would be to donors right now. It's time to put and invest money into chronic conditions. It's cheaper to deal with it right now in terms of prevention, rather than wait when it is a full-blown epidemic or disease and then come and treat it or deal with it. It's timely to do it now.
Sounding like a Westerner right now. We are accused here in the West of thinking of money first, second, and third.
We should. One of my, as I've been doing this, one of my convincing point to a Minister of Health is beside the saving lives and all what we talk about, the economy of it is very important as well. Because look at it, at the end of the day, a Minister of Health is sitting among all other ministers and each one is fighting for money. I mean, the Minister of Education, the Minister of... What would you give the Minister of Health in order to say it's cost effective? If I do this, I prevent that much money. I'll save that much money on the long run. Nobody will question a Minister of Health saying, I want money to educate my children. But people will question a Minister of Health if he says, I want money in order to prevent chronic diseases 10, 20 years down the road. That's what we need to push.
Is it a cultural change that has to happen?
It's a cultural change that has to happen because for chronic diseases, it's not only health professionals that have to deal with it. For you and I to decide to live healthier and stop smoking, everybody around us has to make it easy for us to do so. If I choose to quit smoking, it should be easy for me to stop smoking, not everybody smoking around me. If I choose to exercise and eat right, my environment should allow me to exercise safely. I should go out in the street, not afraid of cars, and have the sidewalks and so on. So it's more than one entity that needs to put all, we need to put all our hands together to do it. The science is there. The prevention will work. We will save lives, we'll save money, we'll save a lot of problems. But the effort hasn't been. And you could look at it from, you mentioned being Western. Let's look at it from that point of view, from a selfish point of view. Let's say I could say if I'm a US citizen, my mandate, my money is to protect the health of the United States people. So in that regard, somebody from China could step on a plane and be here 10 hours later, land in Seattle, could bring an infectious disease. So for my own benefits, I need to prevent infectious disease in China. I mean, if you're looking at it from that perspective, well, if you want to go down that road and think about it in terms of self-interest, well, it's my interest also that Chinese are healthy. They live longer, they're very productive. They have money to buy Boeing and Microsoft. I mean, either way you look at it, it's to our advantage to bring that knowledge we know here in the United States about chronic diseases, how we control them, what kind of programs we should do, and in order to take it to developing countries. Similar way what we did in our knowledge about smallpox, malaria. We did that. TB, we control TB here. We went to other countries and we helped them how to deal with it. It's time to do so for chronic conditions.
We only have about 15 seconds left, and what I'm hearing is that you're encouraged about your life's work. That actually
I am very encouraged, very patient. It's timely, it's about time, and I'm very optimistic that we're going to do something about it.
Thank you very much. So there we have it. We actually can do something about the globe's biggest killers, and that is chronic disorders, non-communicable diseases, the kinds that we would not have known anything about just a few years ago. If you want more information, just go to the World Health Organization's website. Just go on a search engine and you'll find it there. And we'll see you next time right here on Rainmakers.